let me acknowledge the council members that are here, and following me will be Dr. Persse, and then we'll go from there. Uh, uh, Mayor Pro Tem Dave Martin is President, Councilmember Jerry Davis, Councilmember Sally Alcorn, Councilmember David Robertson are here. And then, of course, from the city, Chief Bunick, Head of OEM, Office of Emergency Management, Chief Aceveda, Chief Pena, and then Steve Williams, the Director of Public Health for the City of Houston, is also here. Let me just start off by saying the city is not shutting down. Let me say that again. The city is not shutting down. So I know there are a lot of things on social media. I tweeted something out this morning that social media can be good, but in a crisis like this, social media can work against you. And so let me just say it as clearly as I can. The city of Houston is not shutting down. We are all engaging in social distancing. And so for where there are employees who can do their functions from at home, they're doing that online, teleconferencing, telephone. We're setting up appointments so that the business can continue. We're engaging in social distancing. We're not shaking hands, none of that. But the city is not shutting down. And then we look at the facts and information on a daily basis as we move forward. So let me just say that everybody can kind of take a collective breath, and then we will collectively we will get through this particular crisis. About 1 hour ago, the City of Houston Health Department, the medical community, including members of the Texas Medical Center, opened the first of 4 city, county COVID-19 drive-through testing sites for high-risk symptomatic people. And I think we have a live stream of the site that opened today who are experiencing symptoms. It is important to open this process first to the people on the front lines, protecting everyone else from this disease. And healthcare workers and public safety officials are the groups with the highest risk of exposure and potential to infect other people. We have directly informed members of those professions by sending the test site protocol and location information to fire and police chiefs, Harris County Medical Society, and CETRAC. The COVID-19 drive-through testing sites will expand Saturday, March 21st, to people 65 and older with symptoms including fever. So it will expand tomorrow, Saturday, to people 65 and older with symptoms including fever. And after Saturday, it will open to anyone meeting high-risk testing criteria. The Houston Health Department and Harris County Public Health will open 3 other sites in the coming days for people pre-identified at high risk and announce an online and phone-based screening process. 2 sites, for a total of 4 sites have been approved by FEMA for our area, 2 in Houston and 2 in Harris County. And the first one, of course, we're standing up today. The others should be operational next week. The health departments respectfully ask the news media to refrain from showing close images of the centers when they are operational to protect patients' privacy. And doing so may lead people to being identified and discourage symptomatic people from participating, furthering the spread of COVID-19 in the community. People simply showing up to a site will not be getting tested, so it's not about just showing up because you want to be tested. There is a protocol, and we ask people to follow that protocol. Although we understand the anxiety and community concern, please know not everyone needs a test, and that we have developed a process to identify people for whom testing is necessary. And as you know, it took a lot of work for us to get to this point today. Certainly want to thank our federal partners, and today we have Congresswoman Sheila Jackson Lee, Congressman Al Green that are also present. Want to thank all of our leaders on the federal level for working with us. Want to thank the county Judge Lena Hidalgo, and Dr. Shaw, who you will be hearing from later. Certainly the City of Houston, its health department, Dr. Persse and Stephen Williams, Director Williams, and others. I want to thank FEMA as a whole, our first responders, our hospitals, Texas Medical Center, and our hospitals and their healthcare personnel. It's just a collective effort, and it's another reminder that if we work together, we can get through it. And before I forget, let me just make this announcement. Metro will be implementing measures to promote social distancing by blocking some of their seats. And beginning Monday, Metro will not be enforcing the collection of fares and allowing persons to enter from the rear of the bus to reduce interaction. So that will start taking place on Monday. I wanted to make that mention. Let me yield now, and let me bring up first Dr. Persse, who will be followed by Dr. Shaw, and then he will be followed by Bill McCann.
Thank you, Mayor, and I'd like to thank all of our elected officials up here, and I'd also like to especially thank the healthcare community, the hospitals and the medical schools, Baylor College of Medicine, UT Health. This has been a very complicated, on one level it may look simple, but when it comes to actually executing something like this, it's been very, very complicated. And our friends with the fire department and the health department and the health department have all worked together. And this is not just the city; it's the same folks with the county. And you'll be hearing from Dr. Shaw from Harris County Public Health in just a moment. I want to point out and actually reinforce what the mayor pointed out, is that the testing today is for healthcare workers and public safety personnel who we believe have been exposed and are symptomatic. The reason for that is several-fold. One is that if someone in those professions should be infected and is continuing to go to work, they then become high-risk spreaders of the virus because the people who they interact with are the most vulnerable. Obviously, the healthcare workers who are in hospitals and clinics and such, who would be dealing with people who have come there because they're ill. They often come because they have long-standing chronic illnesses which put them at higher risk. And so we need to make sure that those folks are healthy so that they can continue to work. We also want to make sure that those folks are healthy so that they will stay healthy, because they've all learned they wear their PPE, they understand the practices, but we want to make, if they're ill, we want to identify that early, and so they then protect their co-workers, because not only are they at risk for infecting the patients, they're also at risk for infecting their co-workers. So we cannot afford for folks in those professions, police officers, firefighters, EMTs, paramedics, doctors, nurses, and so on and so forth in the healthcare industry. So those are the reasons why they are sort of being put at the head of the line. Our system that we have in place is one where, as the mayor pointed out, that you cannot just show up. There is a number that has been pushed out through our colleagues and our friends with the SETRAC, which is the Southeast Texas Regional Advisory Council, that has communications with most of the healthcare industry and most of the public safety industry across the region. And we've also employed help from our colleagues and good friends at the Harris County Medical Society, who similarly got the message out, because there may be doctors' offices and clinics that are involved with the Harris County Medical Society, but not necessarily involved with SETRAC. And so we think we've gotten most, but we do recognize we have not covered everyone with this. So for those of you who are public safety workers or in the healthcare industry who did not get the message this morning, you can rest assured we've had communication, and I'm not going to steal anybody's thunder, but we've had other entities across the region that in the next few days will be standing up testing centers, again, for these two particular segments of our workforce, the healthcare workers and public safety folks. So if you didn't get the message today and you can't be tested today, don't worry, those opportunities are growing and coming. In addition today, because this is our first site and it is only one site, there's a limit. We anticipate getting about 160 folks through today. That will increase as we gain more experience and we get more sites up and going. We anticipate tomorrow shifting over to the next high-risk group, as the mayor pointed out. These will be people of the age of 65 and older who have fever. The fever, so there's no confusion, You have seen values of 104 or 100.5 and higher being defined as a fever. Tomorrow, you're going to see with the elder group that we're going to be defining it as a temperature of 99.6 or higher. And the reason is that as we age, our body's ability to generate a fever weakens, and so a lower value may indicate a fever in older folks. So to the media, let me just go ahead and answer that question, which I know is coming about that. When folks arrive on scene at the clinic or at the site, they are then funneled into one of 4 lanes. Each of those 4 lanes is being sponsored and operated by one of the 4 healthcare systems that are out there for this site, and their representatives are here, and those include Houston Methodist, HCA, Memorial Hermann, and Baylor St. Luke Medical Center. But as we got to other sites, there will be others that will be joining in. These are just the 4 that happen to be in this site. And finally, I will want to introduce my good friend and colleague, Dr. Umair Shah from the Harris County Public Health, and he and I have been in lockstep in this complicated process, and I want to thank him and his team, and really Judge Hidalgo and the entire county staff for all they have done. This has not been simple. It's been a lot of work, and I think that we are largely successful. Dr. Shah.
Thank you. Thank you, Dr. Persse. Thank you, Mayor, for your introductory remarks and your continued support. And I want to thank all of our congressional leaders and other partners here. I do want to thank Dr. Persse, in particular. Dr. Persse, he and I have been lock and step with all of the different activities that we have been engaged in, so that we were having a strong, unified public health approach to the different activities that are necessary in our community in order to protect our community. So my name is Dr. Umair Shah. I'm the Executive Director of Harris County Public Health and the Local Health Authority for Harris County. I do want to recognize the fact that this is a joint partnership, city and county together, as well as our healthcare community, and Judge Lina Hidalgo and our county leadership are very committed to all of the different activities that are being described and discussed today, because at the end of the day, this is not just about one part of our community, but it's about all of our community. So I really want to underscore a couple of things. First, from the county side, this has been an incredible amount of heavy lift and partnership, not just with City of Houston, Houston Health Department, Dr. Persse, Mr. Williams, but also with all sorts of other partners. And I want to acknowledge Dr. Persse with Harris Health System, our new CEO for Harris Health, the invaluable work that Harris Health, as well as the Houston Health Department, Harris County Public Health coming together, as well as our Harris Center for Mental Health and IDD, really from a mental health standpoint, all the different activities that are very much a part of this. And I also want to acknowledge our partners at Texas Medical Center, our healthcare community, and in particular Mr. Bill McKeon, who's going to be speaking next, as well as all of our CEOs from across our system. Public health and healthcare have to work together, and the good news is for our community is that we have been working together, and that has been really amazing. It's what we do as Houstonians, it's what we do as residents of Harris County, it's what we do as Texans, is that we come together in the middle of emergencies and we do what's best for our community. I think it's important to remember that this is part of the evaluation process, that many folks are focused on a test, and we want to recognize, again, as Dr. Persse mentioned, that this is about an evaluation. It starts at home. It starts with just understanding, are there symptoms that may be putting somebody at risk for COVID-19? If the answer is no, or if there is no exposure, then this evaluation process largely can stop there, or it can go to the next level of contacting a healthcare provider, contacting any of the health lines that have been set up by Harris County Public Health, Houston Health Department, Fort Bend County, Ask a Nurse at Harris Health System, and beyond. So we have all sorts of lines that have been set up so people have the information and have a way to really make contact. But if that evaluation really gets to the point where really an individual needs to be tested, right now, as Dr. Persse mentioned, that priority population are our frontline healthcare providers, our frontline first responders. We want to do everything we can to protect these individuals who every single day are putting their lives on the line for all of us. And I really want to recognize the importance of being able to protect and make sure those individuals are tested, but also that they are appropriately protected. And that's what we've been working on. Finally, I wanted to say that we have started to see community spread. We know that previously it was one case in Montgomery County. Now we have evidence that there are additional individuals in our community who have been diagnosed, who we cannot determine that they had international travel or that they were in contact with a case of novel coronavirus, and that's how we're defining community spread. We have been saying for the most part that the majority of people that have been getting this disease that we have been aware of, that they have been either hospitalized or they have been in touch with the healthcare system, but they have gone home and they're recovering and they're home, which is good news. But we also know that this disease can be serious. And just yesterday, we confirmed the first fatality in our region. And that is something that all of us have to remember. So all of the social distancing that the mayor, the judge, all of us are practicing it throughout our community is for a reason, that we want to protect everyone in our community, especially those who are at highest risk. So please join us in that effort. Please join us, and I know our community has done a fantastic job. Please join us in doing everything you can to help us fight the fight against novel coronavirus. Thank you. I'm going to now introduce Mr. McKeon.
Good afternoon, everyone. First, Mayor Turner, what these times really test is leadership, and I have to say the great work and the difficult decisions that you've made on behalf of our community along with Judge Hidalgo are bold. They're the right decisions to make. They're difficult, but we at the Medical Center really appreciate the hard efforts and work. Dr. Persse and Dr. Shaw have been in our office for the last 6 weeks. We spend almost every day of every week together. It truly has been a village. I want to invite up just a few of the many CEOs. I can tell you that every morning starts at 7 a.m. All of the CEOs come together and meet on COVID-19. It has been a really tight alliance of all of us sharing best practices and ideas, sharing the cases and how we're approaching them, and actually planning for the future. We don't wait for these things to hit us. We've been planning for 6 weeks. So I'd like to be joined by Dr. Mark Boom, who is the president and CEO of Houston Methodist, Dr. Paul Klopman, who is the president and CEO of Baylor College of Medicine, Doug Lawson, who heads up Catholic Healthcare Initiatives, Common Spirit. We also have Dr. Persse here from Harris Health. So these are the people that represent, and there's many other people, Dr. Pisters at MD Anderson, others that are not here. They're doing the hard work back at the Medical Center. And I'd just like to ask Dr. Boom to share a few words. I will add in with one thing is testing has been going on in our hospitals for many, many weeks. And so this is great, a feat to add more to it, because the more that we test, the better we'll know where our community stands and how we're doing against this incredible pandemic. So Dr. Boom, would you mind sharing a few words?
Thank you, Bill. Again, I'd like to reiterate the thanks to the mayor and to the county judge for, and their entire team really, for collaborating with us on this effort. It's been an unprecedented collaboration across the Texas Medical Center, and I'm here on behalf, as my other colleagues are here, as well as some other colleagues who just couldn't be here this afternoon, to state that it has been a privilege to work at this. As you heard, there are testing lanes from Houston Methodist, from HCA, from Baylor CHI St. Luke's, and from Memorial Hermann, and MD Anderson staff are also helping across each of those lanes. So that is a large number of institutions collaborating very well together. I would like to reiterate a little bit of what Mr. McKeon said, and that's that every one of our hospital systems is caring for patients, and our providers are on the front lines, and they are true heroes in each of our institutions. I want to thank them. I want to thank all the other first responders for the beautiful work they're doing. We are all doing significant testing throughout our institutions as well, and are delighted to be able to help this effort. Thank you.
Now I'd like to ask Dr. Klopman from Baylor St. Luke's to come share a few words.
Well, I'd like to just thank everyone for all their hard efforts, and I want to reassure the community that we are all working very closely together to meet the medical needs. One other thing you might not realize is that we are also collaborating intensively on research, and we are working very hard to figure out new ways to both test and treat this disease. And we are showing the strength of the Texas Medical Center institutions by collaborating and trying very hard to find novel ways and we are leading the country in this area, and you should know that. So we're all here together as Houstonians and trying to do the best thing for our community. Thank you.
And last but certainly not least, Doug Lawson from Catholic Healthcare Initiatives.
Mayor, thank you for your leadership here today. You know, healthcare under the best of times is truly a team sport. And when we have a crisis such as that we're dealing with today, our ability to come together as a community is incredibly important. We're hearing stories daily about individuals and groups supporting our hospitals, our first responders, our caregivers, as they truly lean into this situation to work to make sure our communities are safe, that they're well cared for, and that they're protected. And we thank you for the support that you're giving us. Can't overemphasize the need to maintain our social distance, to take care of the basics, wash our hands, and protect our friends and families from this virus. So thank you all very much for this opportunity.
And I certainly want to thank all of the doctors, Bill McKean and others from the Texas Medical Center. And as you can see, it's all hands on deck, all hands on deck. And when we all are working together, there's no question that we will overcome this virus and move forward. I also want to thank our federal partners, because it's all of us working together, not just any one group, but all of us working. We're stronger when we're all doing that. And for the resources that have come and the resources that will be coming. And so let me start off first with Congressman Al Green, followed by Congressman Sheila Jackson-Lee for their comment.
Thank you very much, Mayor. I concur with you. We will get through this, and we are all in this together. I am very pleased, Mayor, that you have moved to open this new facility. This facility is going to help our first responders, the people who make it possible for us to have a better quality of life because they're willing to risk their lives. It is appropriate that we do this. It is a partnership. FEMA has been involved in standing up these facilities. Federal resources. Federal resources go to the hospital district. Proud to be here with Mr. McKeon, the president. Federal resources go to the county. Proud to know that Dr. Shaw is here today. It's very important that we emphasize the unity and the teamwork and the fact that we have all of our resources coming together for this cause. Proud to be here with my colleague, Congresswoman Sheila Jackson-Lee. We plan to work together to provide as much resources as we can to make sure that the federal government does its part. Now, more specifically, there are people who are suffering. I want you to know that I extend my prayers and my concern for all who are suffering. This is a time of great need for a good many people. We have to be there for you. This is what the government is for. The government is for the people in a time of crisis. Without question, this is a time of crisis, and without question, this partnership will get us all through it. Thank you, Mayor. Thank all, and God bless all.
Mayor, thank you very much. I think I want to take a moment to just say the very obvious, that this has been a very, very difficult time. And difficulty does not suggest inability. So I want to acknowledge the team of Mayor Turner and Judge Hidalgo, but as well, Mayor, to be able to say that your entire team throughout the city, including the health department with Mr. Stevens, Dr. Persse, including the county, Dr. Shaw, and the team with Judge Hidalgo, the fire department, Chief Pena and all those staff, and of course, we could not have done the testing that we're doing in Northwest Houston without the first responders, which includes the Houston Police Department and the chiefs that are here, Chief Acevedo, Satterwhite, and Finner. I want to personally thank them publicly for all the men and women who've been so helpful. I think it is important to note that you're not going to be finished testing in the next couple of days. So it is our charge and challenge, even for our friends in the medical center, and I want to thank them extensively. We've been having conversations, and I thank them extensively, but it is our task to make sure that we can continue to provide the tests for all of the governmental agencies that need them. And so, and let me make mention of the council members, this is a team. I want to just emphasize our work to get those tests produced under the Defense Production Act to accelerate the production of tests, Mayor, so that you will not be looking for tests, that you will have tests. I think the second point I want to emphasize is the public. We have found that more millennials have been seeking testing, and I want to applaud them, as well as their restraint and their recognizing of social distancing. But I'm also going to ask the community to work with our seniors. In many instances, our seniors are not mobile on their own. I know that there will be some considerations how to assist them, but let us, with all the carefulness that we need, make sure that if there are seniors in your family, that you're able to provide them assistance for the facilities that we now have across the city extensively as they begin to open. It's very important that we get our seniors out, but I'm very thankful to know that millennials are listening here in this community, and they are assessing their symptoms, and they're seeking to be tested. We should know that if you have symptoms, it's across generations, and so we're very grateful of the processes being utilized here, and one that has already been utilized in the stand-up center that we already have. So I want to thank you again and offer our commitment as I close, Mayor, to your PPEs. That's what we're trying to increase and get through the federal government, and more tests, and that is for all of our medical professionals to get as many of PPEs as we can get, personal protective equipment. And so I'll just simply say that people have been saying that you prepare for the worst and hope for the best. I'm going to change that around a little bit because this is a tough, gritty city, and we are Houston strong. I want to say that the worst may be in front of us, but we're going to be prepared not only with hope, but with hard work. And I think together we will be a very unified community and get through this together.
And let me thank everyone. This is a family affair and an extended family, and we're all having conversations and numerous conversations, all working for the greater good. I do want to recognize Councilmember Tiffany Thomas, who's here as well. Thank you for being here. And I want to give just special acknowledgments to our first responders represented today by Chief Acevedo with HPD, Chief Pena with HFD, George Buning with the Office of Emergency Management, Steve Williams with our Health Department, all of our, Mark Eichenbaum working with our homeless population, Andy Eakin, Chief Economic Development Officer, because it's a holistic approach, and we know that we have to do everything we can to slow the progression, to blunt the progression, because we don't want to overwhelm our healthcare delivery system. And so we're all working hand in hand. So let me repeat, the city is not shutting down. The city and everybody else, city, county, we are being strategic, okay? We're not shutting down, we're being strategic. And we're making some very measured, methodical decisions as we move forward. And just to show you just how much we're working together, just today, the city of Houston partnered with Home Depot to secure additional emergency items for our healthcare workers and first responders. We have a long-standing relationship with the Home Depot, and not only do they provide jobs for many of our citizens, but they also support communities throughout Houston during times of crisis and natural disasters. And we appreciate the Home Depot and other essential retailers throughout the state who are doing all they can to provide the urgent products we all need, whether that's hot water heaters, refrigerators, or electrical and plumbing repair needs. And we also appreciate the Home Depot for expanding paid time off for their hourly associates who work full-time or part-time in response to COVID-19. And during these uncertain times, we are grateful for companies who are doing the right thing and supporting our citizens so that they can protect their health and those around them. Again, I want to also thank our retailers, and also Scott McClellan earlier. I don't know if Scott is still here, because they've made it clear stores are not shutting down. The food supply chain is fine, and so you don't have to rush to the grocery stores. And that's why I want to emphasize again, we're not shutting down, so people don't have to go rushing, thinking that you're going to have to go and buy supplies that will last you, 2 to 3 weeks. So we're not doing that. So again, get your information from credible sources. That's very important. Social media is good for saying hello. It's good for that. But when it comes to a healthcare crisis, these are your trusted partners. Okay? We have the medical community, the medical center, the largest, finest in the world. I think we can trust them. Dr. Shaw, Dr. Persse, I think we can trust them. Our federal leaders, I think we can trust them. And all of our first responders, the council members, Mayor Pro Tem Martin, and all of the other council members, let me thank you all for your incredible leadership. So social media is fine. We're saying hello. And today is my birthday. It's not my birthday, but I'm just saying, But the point is, but when it comes down to determining whether the city is going to close or shut down, there are really only 3 people, really as it relates to Texas, that can make those decisions. That's the mayor, the county judge, or the governor. And if you don't hear from one of us 3, then you have not heard it. And so but we're going to be measured, we're going to be prudent, we're going to take the necessary steps that we need to take in order to slow the progression. So I think that's it. If there are any particular questions to any of these individuals, we'll take those at this time.
All right, I've got questions from 3 different stations, just so you know, so might be here for a while. But starting with, can you clarify the requirements for the healthcare workers and first responders who could get tested today?
Dr. Persse, Dr. Shaw.
So the healthcare workers and the first responders are going to be people who are actively employed by an ambulance company, a fire department, or law enforcement. A healthcare worker is somebody who's actively employed basically by any sort of active healthcare provider, a nursing home, a hospital, a doctor's office, a clinic. They'll just have to work somewhere actively in the healthcare or in the public safety field.
Is there a fever threshold for them, or is it just having symptoms they can come?
So when they talk to the nurse will review their case and see if they have the symptoms that match this particular illness. And that's why we talk to the nurse as opposed to it just being a, check the box, because there's a conversation that needs to occur to make sure that there's somebody who sounds like they have it. There's a lot of people out there who are scared. We recognize that, but the testing is limited, and so we really need to target the folks who it sounds like there are people who really need to get tested.
In the meantime, are those healthcare workers going back to work?
So if it sounds like, and that we've got some clinicians involved out on the scene, if it sounds like there's somebody who sounds like a high probability they're being advised just like everyone else is, and they should know this. These are healthcare workers and public safety folks. They shouldn't need to be told. If they have symptoms, it sounds like it's consistent, and if we're testing them, then they probably need to quarantine at home. But they should already know that. We don't need to tell them that. They already know that. In fact, they're probably violating their quarantine, if you will, by getting in their car and driving. They're not really violating the quarantine, because the quarantine doesn't mean that you stay locked in a room. It means, that's the easiest way to do it, it means you have no person-to-person contact. In fact, if you were able to see inside the tents, you would see that the people who are doing the actual testing are wearing full PPE, and then the conversations are occurring 6 feet apart. So we're managing that all those protective measures out at the site as well.
Looking at the testing site that opened yesterday where people were waiting for a long time, is the city and the county pulling any lessons from yesterday?
Yeah, so we are pulling some lessons from yesterday. Now, those are not city or county sponsored sites, right, but certainly our law enforcement folks are out there. Chief Satterwhite and his team manage the traffic flow, and we were able to observe their process. And not only that, but at the United Memorial Medical Center site in particular. I've been in contact, and I think Dr. Shaw has as well, with the medical director out there who has been very cooperative, and cooperative isn't the right word, he's just been, very forthcoming with their plan and how they're managing things. And so, yeah, there's all kinds of exchanging ideas. Everyone is on the same team here, and so we're going to learn. As we go, we're going to learn. So, do you want to add anything? I handled all three of those questions, but.
Just adding to what Dr. Persse said is that it's not just what we're seeing in our own community in terms of other testing sites or testing centers, but really looking also across the state or across the country. Dr. Persse, myself, as well as all of our healthcare partners have been really looking at what are the best strategies that we can apply, that we can adopt here for what you see behind me right now, but also for additional ones that are going to be opening. So we're continuing to refine, and even today, one of the reasons that we wanted to have this really an opportunity to allow this testing site to continue to work through the afternoon into later in the day is we want to then be able to continue to refine for tomorrow, and then what happens tomorrow will help us refine and define for Sunday, and so on and so forth.
What's the current turnaround time for the testing, and how are we, you want to get in on that one?
You mentioned the United Memorial Medical Center, so let me just, since we opened it yesterday, and say we're delighted to be sort of a study in progress for the other sites that will be open, but we were very pleased with the fact that people adhere to the protocols in terms of coming, going through a process of assessing whether or not they had the symptoms and accepting the fact of whether they would be tested or not. I think the very fact that they have heard coronavirus, and test motivated the extensive lines, but the process was quick, and the numbers that we were able to do yesterday were very sizable. And again, we did test across the population. That's how we determined that a sizable number of millennials, persons between 28 and 45, were coming to be tested. That's a good thing, but we are excited about the strong presence that the county will have and the city will have, and the help that it'll give to the medical professionals and police and fire, but then, of course, the seniors. And that was my point. Let us assist seniors to get to these sites, or however the county and the city are going to structure being able to do seniors. But we were a good model, and I'm glad Dr. Verone has been communicating with all of the health leadership. And I think as we continue today and continue on, we'll be helping and complementing the process that's going to be used by the city. Most people did not, except for making the point that it was a long line, did not find that to stop them from coming. And I think that's the good news that we have. That's how we're going to save or protect this community.
And while I have you, is the turnaround time for those tests still the same? What's the expectation on those?
The ones yesterday, and obviously labs are backed up, but the ones yesterday are expected late afternoon, early evening, or by tomorrow morning.
Okay, all right. And for the testing site that's open today, is it the same turnaround, or have we been able to speed it up at all?
So as the Congresswoman just mentioned, is that, obviously we're mindful as more testing happens, we certainly are going to have additional laboratory results that may potentially have some more hiccups in that backup in terms of the number of tests that can be processed, how quickly. But in general, 2 days is the goal. So it's not that it can extend a little bit more. So we want our public to obviously continue to be patient with us, but really our goal, our intention is 2 days.
And how are we getting those results to people?
Yeah, so Dr. Persse, you can come on up. Because these are healthcare workers, and obviously we're starting with healthcare workers, our first responders, so we obviously have a more definition about how to get with them. We're then turning around and getting those results to them because we now have that contact information. As we move into the public, we've also have some additional strategies on how we're going to be notifying that individual, as well as obviously if the test result comes back positive, to the local health department. So those are strategies that are in place, a little bit different for the healthcare worker and the first responder because of obviously more of a connection to our system already. Dr. Persse.
So you're going to find that as these sites come up, they're going to operate a little bit differently depending on some particulars, but for this one that you see behind me, as I mentioned, there are 4 different lanes run by 4 different healthcare systems. And so when they come in, they're going to be, that hospital system is going to be responsible for getting the results from the lab that they're using and then communicating it to their patient, essentially. And so that's why there's 4 different lanes as opposed to just mingling everyone together, because we're able to keep it within the hospital care systems. And as you know, they are very good at managing, protected health information and getting test results and getting those test results to their patient. So it's going to go that way, following the normal processes as much as possible, because those are reliable and dependable and they work for decades.
You mentioned earlier, or I think the mayor mentioned earlier, a screening ahead of time as we move forward. What might that look like?
Yeah, thanks for that question. So we've been working behind the scenes, county, city, and our healthcare partners to develop not just a mechanism from a phone triage, if you will, but really an online system, a tool. That tool we're still working through to assure that it's ready to be deployed in a larger setting. But that tool is really designed so that the vast majority of people who are potentially going to be using it are going to be reassured, because they may not meet the criteria, again, part of the evaluation process, that they even need to be tested. But then it will then feed into a triage system so that the authorization then can be generated in order to go to the site. So I think this is an important piece that Dr. Persse mentioned earlier, the mayor mentioned earlier, and I just want to reemphasize, which is we do not want people to go to the actual site unless they have been authorized to go to that site for testing, for specimen collection. This is not a walk-in site. This is not a walk-through site. This is, as you see with vehicles, this is an authorization process so that only the individuals that have been authorized to get the testing done can actually go there for the specimen collection. So we want to make sure that that's clear, and that's the way that we're planning on doing this for the other sites that would be coming up as well.
Mayor, this one might be for you. Should non-citizens experiencing symptoms have any immigration enforcement fears while going to a screening or testing site?
Well, just like the coronavirus is not discriminating, neither are we. Okay? So if people are experiencing symptoms, and I said people, that are living in our city, in our county, then they need to call or go to the website that will be given, and then go through the regular process.
Does the supply problem with personal protection equipment and testing gear pose a risk of closing the testing sites down the road?
Well, we're hoping not. And we're hoping that we will continue to get the PPEs that we need. And at this point in time, if Chief Bunin can correct me, but I think we have all of the PPEs that we need for the 4 sites. Yes, sir. If you want to.
Yeah, yesterday we received the strategic national stockpile that was inventoried at the main city site. It was divided up into 4 different sections, so that Harris County has 2, City of Houston has 2. So we received all that PPE and equipment from our strategic national stockpile, and that came from the federal government.
And now what we're doing, we're making sure that we have additional equipment and things that are needed for our first responders and everyone else. So, but I think we have what we need in terms of PPEs to set up now to stand up all 4 sites.
Okay. All right. I'm going to let the Chronicle step in because I've been hogging the mic. Okay.
My question was going to be about if the opening of the next testing sites was contingent on getting more PPEs. So what are you guys waiting for to open those remaining sites at this point?
Thanks for that question. So I think there are a couple things that we're looking at. One, as I mentioned, that we're looking at understanding how this flow behind us is working and certainly refining things based on that. We also have federal assets, not just supplies and PPE that have come in, but also personnel that have come in. And so we're also working with that federal system, our state partners, to really assure that we're ready to move forward with opening, and to the previous question, that we can continue to sustain, because it's not start, stop, start, stop. We want to sustain our ability to be able to open and obviously serve the public.
If anyone from the medical center could answer this, I'm wondering if there's concerns about a shortage of protective equipment either at the moment or whether you anticipate that happening in the near future.
Sure. We spend almost every day, so we convene the supply chain leaders of all of our major health systems across the medical center. And these are massive institutions that have large needs. We treat 10 million patients on our campus every year. So supply chain's a really clear issue. You read about it in the paper nationally about people, and you're finding a lot of people are becoming innovative around the creation of new products. Remember, China was one of the major distributors of personal protection equipment, PPE, and during their outbreak, they obviously cut those supply chain lines to serve their country, which obviously makes sense. Now that they've had no or very limited new cases, those lines we expect to open up. So it's key on the PPE, but also on the equipment that we use to test patients, and that's also in short supply. What's great is our incredible institutions have been ramping up their own labs, and so we're seeing the scaling up of those labs. And then the national labs are also scaling up in numbers that almost double every week. So we're hoping between opening up the lines of the PPE and the testing equipment that we'll be in much better shape as each day passes.
And just one more for you,
Yes,
Doctor.
sir.
There have been some reports of, folks using like bandanas and, even having to use like surgical masks. There's some concern about or question about whether that adequately protects. Do you guys anticipate kind of taking alternate measures like that to use things that aren't maybe ideal to use to protect?
Sure, you're seeing strategies like that happen around the world and also across the United States. What we really do is we want the most high-end protective equipment, those N95 masks that seal around a person with face shields, with gloves, with gowns, is really important when you're maybe testing a patient and being clear, and you'll see that on the site behind us. But there's also strategies that are using still surgical masks, but maybe not the N95, which are in short supply. But even those numbers of N95 that was through the great work of the city, the county, congressmen have been helping out. You're seeing those supply lines start to open up, and we're seeing them in much larger volumes than we saw even 2 days ago.
One last question for the mayor. I know you're not planning to shelter in place at the moment, but is there a scenario where you would support implementing a lockdown for the city?
Just based on the facts and the medical advice that we are given, we'll entertain whatever is best to make sure that we maintain the health and safety of the people in our region, and to make sure that our healthcare delivery system is not overwhelmed. But we'll take it one step at a time. We always look at all different scenarios. But where we are today, we are not shutting down. We're simply being strategic.
And are you and the county judge on the same page about this as far as you're concerned?
We are partners. I would say we are arm in arm, but that would be against social distancing. So let's just say that we are walking we are in step together, okay? And I talked with her not too long ago, about an hour ago, about a number of different things. We've been partners on this matter since the beginning, and we're partners now. We'll be partners as we move forward. These are not tough decisions for any of us. And I think what we are trying to demonstrate to the public today is all hands on deck, and we are all working together in the best interest of the people in our region. But they are very difficult decisions. And I think it's only natural. You'll have good conversations, but in the end, there only is one question: is what's in the best interest of the people that we represent. So I have enjoyed my partnership with her. I think she would say she's enjoyed her partnership with me. And, we just can't go to a restaurant right now, but, you know, I started to say something else, but that, you know, you can't get a drink. But, but no, things, we're moving forward. So no shutdown, just simply being strategic, get your information from credible sources. And let me just say, and I think that they will all agree, because there's more testing, the numbers will go up. So let me just deal with that expectation. Okay, the numbers will go up. As you do more testing, the numbers will go up. That should be expected, but we're dealing with it. And then lastly, one of my council members asked me to make sure that I emphasize this, and that is, even while we're dealing with the coronavirus, COVID-19, please fill out your census. Please fill out the census. Because when we are talking about grants and research dollars and dollars to our medical centers, hospitals, healthcare delivery system, colleges, universities, transportation, the census is very important. And so in Houston, we can do more than one thing at one time. So as we engage in social distancing as it relates to this virus, we can also take the time while we are at home and online, okay? Just go online to the census and fill out those 9 questions and send them back and be done. So you're at home, take care of the census. Okay, so let's do that. Last question, then we're going to wrap it up. I know it's been already.
Yes,
Okay.
The question is there a limit about how many times people can be tested?
Dr. Shaw and Dr. Persse, this year? Is there a limit on?
Oh, thank you for that question. Sorry I didn't hear it at the beginning. Again, I want to just make sure we remember that it's an evaluation process. And so if somebody gets tested and their test is negative, Dr. Persse has emphasized this over time, that the testing should happen when somebody is really displaying symptoms. But let's say that get tested, it's negative. Turns out that it was the flu. 2 weeks later, you have symptoms, and now it is mimicking really similar to what you had 2 weeks ago, or you've now been in contact with somebody who has coronavirus, novel coronavirus. So at that point, a retest would be appropriate to determine if that new exposure may have now given you novel coronavirus or COVID-19. So retesting in that kind of a scenario, and obviously there are thousands of different scenarios that we could go through, in that kind of a setting could absolutely be there. But what we don't want to do, though, is somebody who doesn't have symptoms, one goes to say, I need to get tested, or somebody who just got tested says, well, I don't believe I'm going to go back, and I'm going to go back, and I'm going to go back, and I'm going to go, and they keep, because we still have, a limited supply of testing, and eventually, even when that opens up, and the mayor is absolutely right, we're going to have more cases, and that's going to continue to rise over time. We don't want people to use tests as part of the default, and then we have another problem, which is we don't know what to do with all these tests that are out there, all the negative tests for that one individual. So that's why we want to make sure it's not a test, it's an evaluation process that doctors and nurses, public health, we do every single day with our patients. It's an evaluation process, and the public, to help us be able to do that, helps all of us get through this as best we can. Dr. Persse.
I just want to add one other thing, because I noticed this in some conversations with non-medical folks. The test it's a test. It's not an immunization. I've heard some people want to get tested so that they then won't get ill, and that's a misconception. If you get tested, it's like taking a single frame out of a movie. You can see what is on that frame that day, whether or not that person had the symptoms. But it doesn't provide you it's not a vaccine. So just make sure everybody understands that. It is what it is. It's a test, which should be part of a larger evaluation. And it's really the evaluation and the answers you're looking for.
Just one more. Understandably, some people may get positive results back today. What's your message and instructions for them?
Yeah, that is a great and important question, so thank you for asking. In our system today, and remember there are a variety of places that are going to be testing, so they will probably to some degree be managed a little bit differently. But the bottom line is the common denominator to that is if somebody tests positive and they are minimally ill, they should isolate themselves at home. No person-to-person contact so that they don't spread the virus, And then when their symptoms are done, working with their healthcare provider, they will then manage how this thing comes to a complete end. And you heard about the case in San Antonio where there's supposed to be, 2 tests at least 24 hours apart before somebody is released. And for each individual patient, depending on their healthcare provider system, those details will be worked out that way. But the quick answer is if somebody gets a test result today and they're minimally ill, they don't need to go to the hospital, they don't need to go to the emergency department, they need to isolate themselves at home. Should they then become sicker and start having trouble, then they need to get themselves either to their doctor, or if their doctor thinks they need to go to the emergency department, to the emergency department. But whichever way, make sure that you call ahead so that they are prepared to receive you, get you in right away, get you into an area that's protected, and then start dealing with the complication of the infection. So the infection is just that, it's a viral infection. But if people start suffering complications of it, that's another issue that needs to be dealt with specific to the complications that person's having. So again, bottom line is, if you get a positive test, isolate yourselves at home, monitor your systems. If you get into trouble, reach out to your healthcare provider for the specific management of your situation. Okay?
All right, hashtag Houston Strong, hashtag Houston Strong, hashtag Houston Strong. Put that on social media, okay? Yeah, hashtag Houston Strong. As we've overcome before, we'll do it again. Thank you so very much. Thank you, everybody, for being participating.